Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
At the beginning of each workday, the operatory is wiped down with a phenolic agent and a new room forceps is placed. In between every patient, the room is prepped with the Physahex soap tissue. Prepping of the room includes 5 main areas. They are the opening of the towel dispenser, the mouth of the cabinet, the chair button covers and headrest adjustment handle, both handles and switch to the light, and the motor. The top of the cabinet contains forceps, extra instruments, mirrors, curettes, handpieces, and other special instruments not contained in the cabinet are kept in the staff center. Special instruments need to be requested from the staff. Top drawer contains blood pressure cuff and stethoscope, post-operative care instructions. Center drawer, white tray covers. Bottom drawer, pre-packaged sterile gauze for home care and aspirin. Top right drawer includes sterile gauze and additional solo cups. Center drawer, needles, anesthetic, cotton buds, and betadine. Bottom drawer, 15 blades and silk suture. Underneath the cabinet, additional materials are stored: denture cups, emesis basins, hat tissues, as well as other supplies. Sticks are used initially by instructors as well as students before an assignment is given. This avoids contamination of the tray should the procedure be postponed for any reason. Exam sticks are also used at the end of your assignment. When entering the operatory, you must scrub. Before you open your tray, the white towel covering the surgical tray is placed over your water pitcher to provide you with a clean surface for handling. Begin unwrapping the tray setup. The mayo cover should be allowed to hang loosely over the mayo stand and should not be tucked in and under the tray. Allow one end of the suction hose to hang over the front of the tray. Locate the gauze and remove the safety pin. Secure the hose to the mayo cover as shown. Arrange the instruments on the tray according to the order of their use. The diagnosis and treatment plan will determine which forceps you will use. Remove the proper forceps from the top of the cabinet and open the packages onto the tray. Never lay the packages on the tray. The room forceps serve only one purpose, to allow you to remove needles, anesthetic, or gauze from the drawers. It is not used to remove anything from the top or the bottom of the cabinet. If the room forceps is used anytime during the procedure, the operator then must re-scrub after returning the forceps to its holder. Use the room forceps to remove the necessary materials for local anesthetic. Place the materials in the paper solo cup provided on the tray. Return the room forceps to its holder. If predetermined, barred Parker blades and sutures should be opened onto the tray. Lastly, connect the suction hose to the suction jug. Re-scrub. Remember, you must re-scrub after the addition of any forceps or materials to the tray or handling of the room forceps. Irrigation setup is used for either periconitis or osteolytis alveolitis irrigation. Open the setup in the same manner as the surgical tray. This setup contains a suction hose and tip, an irrigation syringe, mirror, cotton forceps, and scissors. The solution you will be given depends on the procedure. Sterile water and dental loan dressing is provided for alveolitis treatment. Suture removals are done from the top of the cabinet. Once the white towel is open, it provides you with a sterile surface for placing the removed sutures on. This avoids contamination of the surgical tray. This setup includes a mirror, a cotton forceps, and the scissors.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.